So, occupational and environmental physicians can help business and industry sectors in multiple ways. I think one way of looking at that would be looking at prevention. So, with programs such as health surveillance and looking at exposures to prevent illness before it occurs. Then there's the more reactive approach. So when an injury or an incident occurs, going in to provide management and treatment both to the worker and helping inform change for the workplace to prevent it from happening again in the future.
So OEMs can help businesses and organizations by acting as the link, that missing gap between the medical fraternity and the OH&S component, and also consideration of occupational and workplace risks and hazards. So OEMs hold that unique ability in terms of an OHS skill set and a medical background, and often with political legal experience as well, to provide a service and consultancy that actually has major benefits for organizations, not just in cost savings from, say, work cover, but also in improved worker health and improved worker productivity.
So the way that an occupational environmental physician can assist businesses, for example, in managing their risks or manage their compliance with certain legislation, can be in a variety of different ways. So, for example, we can assist a business with a group of individual workers doing a high-risk task and help them with the risk assessment, help them to manage the potential health risks from the work. We can also help them comply with the legislative requirements that might be part of that work. For example, if they're working with hazardous substances such as lead or asbestos or silica, we can help them with the health aspects of managing that, with their health surveillance, also preventative toolbox talks, we call them, where we can give some education to workers. And for big companies, we can help with the more strategic policy development and implementation. For example, drug and alcohol policies in the workplace, we can give some health advice around that. We also are mindful of anti-discrimination legislation, work health and safety legislation, how they interact. We can sort of help from the individual worker to the workplace, to the type of work in managing their risks and compliances and their legislative requirements as well.
I think OEMs can help in a multiple different ways, and it really depends how they're engaged with a specific problem. For example, a workplace can reach out if they have a specific problem, such as injury management, and an occupational physician can come into that business, examine the problem, and develop a solution for that workplace. An OEM could be part of an organisation, and as part of that, assess data, analyse data, provide policy solutions and other solutions on the ground, and that might be occurring in larger organisations such as oil and gas, such as mining. That occurs very quickly. In my situation, I'm in defence, and that's my position. OEMs can also help individual workers for workplaces by helping them to return to work, by developing successful return to work plans to ensure somebody is able to return to work earliest and in a safe and successful manner.